We are back. We are back. We are back. We're back. We're back. Ooh, we are back. It's just that I'm not supposed to stand and do a whole dance, guys. I'm so excited. We are back. Be Different is back. Woo! Welcome back, guys, to another episode of Be Different podcast. I was thinking about it. Was it yesterday night? I think we are going to the 70s. It's episode 70, if I'm not wrong. I'm not sure, but we are there. So we have a very exciting guest. I'm so excited to have hosted you, and I'm so excited for her to say yes and to make the time. So Dr. Karen, please introduce yourself and then tell us more, about yourself.
Thank you so much. I'm very excited to be here.
Karibu.
Yes. My name is Dr. Karen Muthembwa. I'm a resident in obstetrics and gynecology. That means I'm doing my master's in obstetrics and gynecology. I'm also an entrepreneur. I'm also the founder of Dr. K Foundation. And a daughter, a sister, a friend, and a lot of things. I'm so glad to have you here. Thank you so much.
Thank you for coming. First, before I forget, so is your life like Grey's Anatomy? I know I asked this before the cameras were rolling, but I still want to ask it. Do you guys live like in one big house, eating pizzas and so busy and just?
I wish.
Like one person is leaving the house, the other one is coming in.
Oh no! It's well, that's the form of residency that seems to be, as in fun, attractive, and that's why you watch the
Grey's
series.
Anatomy.
But if you really get to the reality of things, even in the US, it's not the same. This is a high pressure zone. And maybe you see part of it also on Grey's. They find ways to balance it out. They also show like the different situations that we go through, which are true, like grief, going through grief, going through your own personal things, and then failing results.
Research. I've seen so many aspects of
it. So it has some aspects that are true, but that one has been made to look more interesting so that you can watch it. But go to our maternity, all maternities, let me tell you, you feel like, but some of them, like there's another one, I usually watch another TV show that kind of shows, it's not ER, there's another one that shows the ER, the real deal of what happens. You might be having even 4 patients who are you consider very, very sick, and those 4 patients can keep you there. Even one patient can keep you running the whole night. They need ICU, they need tests done, they just need you every minute, every second, and that emotional attachment to that patient, that can happen because you want them to get better. You don't know them personally. I don't know the patients that I get, but you need to get them better, So that kind of thing is true. But the nicey things, not all of them, none of them are real.
Wow. Okay, so tell us what you actually do. Now let's demystify the name.
Okay, so Dr. K. So my other name is Dr. K.
Yes. You said
obstetrician, gynecologist.
Yes. So that one. What that one does.
Okay, so I'll divide it into 2 because these are 2 difficult names. Obstetrics, meaning the study of pregnancy and related issues.
All right.
So if a pregnant woman has anything that is related to that pregnancy, we treat. So things like just the pregnancy itself, it's a natural process. It's supposed to be that way. And there are some conditions that come with the pregnancy. We treat that. We manage you up to the time you deliver healthily and also have a healthy baby. That's the whole study of obstetrics, is to have a healthy mother and a healthy baby at the end of it all. Then gynecology is now the study of the reproductive system that is not pregnant. So anything that any lady or even a guy has when it comes to their reproductive health, that area, although even if it's called gyne is female, right? Andro is men. Most of the time it's women with those issues. Men tend to have less issues, but they do exist. So it's anything that involves the reproductive system, that one, we deal with it. So we deal with both. So you can be an obstetrician and gynecologist. But once you specialize, you can actually specialize into just mother and child, maternal fetal medicine, where I only deal with that. I don't do fibroids, I don't do discharge. You know, most of the things we have, like every patient who comes to me when I'm busy studying how to transplant a uterus from one to another, they just discharge. That's the main complaint, most of it. And of course, abdominal pains. So those are gynecological issues. But anything obstetrics, you can actually specialize. You can specialize in fertility. So you leave mambo ya pregnancy and go to fertility only. You can also specialize in oncology. Every cancer that involves the reproductive system, now that is called oncology, gynecology, oncology. So you can subspecialize in so many things in the same field. So now we do general. Like for me, now I'm doing general, everything.
Why do we, correct me if I'm wrong, but I feel like we always feel like people who have money are the ones who can afford gynas. Are you guys that expensive?
Imagine it's not true. You can go to, you see, the thing is, we believe that people believe that we are only in our private clinics or in the big hospitals, private hospitals. I work in Nanyuki Hospital before I came back to school. And in Nanyuki Hospital is government hospital. The same thing you pay for any consultation, same thing for a gynecologist. We are there. The only difference is a gynecologist in Kenyatta Hospital, you may find them in the corridors of Nairobi Hospital. The only difference is the building. So depending on where you want to go, that's where you pay differently. Because you can decide to come to Kenyatta Hospital and find Dr. K there. They will charge us, they will not charge personally because that's not our mandate. We don't do that. It is within the hospital confines. So it is possible to have a specialty at an affordable price, and even sometimes for free if you're using NHIF, because that insurance is a national insurance fund and it is available for all. So if you only pay a certain amount every month, usually 500 per month, you can access any form of health in all government hospitals for your family, whole family, for 500 bob. That's what people don't know.
Wow.
Even in Kenyatta, we do surgeries fully funded by the NHIF, by gynecologists, by neurologists, surgeons, So it is affordable.
But there's so many things that we do not know. I wanted to ask you, how do you feel like the system treats you? I'm not sure whether I wanted to go there very fast, but then just answer. How do you feel like the system treats the doctors?
Lately with the changes in COVID, we learned quite a bit of things in terms of how we and the system that controls the health system work and how symbiotic the relationship is. And this opened a lot of loopholes. At the same time, it also showed us, there was some goodwill as well. In terms of the Kenyan system from a long time ago, we've had a lot of run-ins as doctors with government involving our state of health personally, even for us, sometimes even affording the same thing that we give to other people may not be the same. Although within doctors, we don't usually, it's unsaid rule that I can see you, you will not charge me. That depends on how the relationship is, but usually we don't charge professional fees within ourselves. But it doesn't work for family members. Like now I bring my mom, but sometimes we have that kind of thing where you have a doctor who will not charge for at least a consultation fee, but the hospital fees will still be paid, so it's still quite expensive. It's not as cheap. The other thing is working conditions for doctors. Up to today, we still don't have the optimum working conditions that we require as the doctors. There's a standard to it. I will not compare it with other countries because in Africa we are okay. In Kenya we cannot complain, but we're still not up to the standards. We still need to have better facilities. Our facilities are lacking. I can't be treating a patient and I write a medication, and a medication, because this medication is better than what is, you moved up because maybe the pain, it's maybe a painkiller or something, and that painkiller is not in the hospital. Then the patient comes back to me and says, Doctor, so this painkiller is not there. It's not good for us when we cannot upscale our management. We have to stick to the same.
So what's there?
Level.
That's what you just write. What's there?
We either write what's there. If it's not working, we ask them to buy it where they can be able to get it. But you see now, you're moving a patient from where they're covered fully by their insurance to go out there and buy with their own money, which again is hurtful to the patient. And then sometimes you'll find patients not coming back because it's too expensive, you know. So there's that issue. Sometimes you want to do something, but because even the level of learning, like now I do oncology, let's say I do cancers of gynecology, and there are machines that are needed. Let's say that machine is only in Kenyatta. I go back to my home county, you know, not really home, but work county. Although I know in ours they are really trying. I really hail Laikipia County government.
Nice.
They are really doing a good job right now, especially also with the management of doctors. They are trying to get a machine for checking for these small, you know, changes in the cervix. It's called a colposcope and all those that will help our women in Laikipia County. So if you don't have that, even with the skills, how am I helping my patients? If I need a mask and the mask is not available, how will I work? Because also I have to be safe first, which is not something mean, because even on a flight, you have to be safe first before you can help a child. Because if you're not breathing, how will you help a child who's not breathing? You have to breathe. So if I don't have mask, or if I don't have gloves, or if I have to keep asking for something that is needed, then it doesn't make sense. So we are having a lot of that still happening in counties, and also lack of support in terms of studying. We need to go back to school. If I remain the same, then you're just using a worker who's not improving, who's not helping your people. So if counties are not allowing doctors to go to school, well, they also have their own reasons. You see, now when you understand the symbiotic relationship, it makes sense. But where are we? What is the solution? Where is the solution to this problem? Because I need to learn so that I can be motivated. If I'm a doctor and I'm still doing the same thing in and out without the medication improving, nothing is improving, what is the point? So you have a lot of...
It's interesting you say that. There's a question I've written, was it today morning on my Instagram stories? I was like, should we ask to see licenses of the doctors of clinics mtaani? Because 1 minute you feel like they're so good. Then the next minute you feel like, we alianguka class, akakuja kufungua clinic hapa. So I was asking myself, so should we be... just out of curiosity, because you really, you know, like yourself, or you may want to rush your child there or something. Should we be asking to see their licenses? Is it just someone who passed in class and, you know, maybe it's their side hustle or not? I didn't know. And I just thought about it today and I was like, and I put it up there. What do you think?
Well, I don't think every time you go to the hospital you'll have to keep on asking for the license.
No, for the clinics mtaani. You know, the ones we are saying, zile ziko kwa estate.
Ideally we should even put them up. So you should be able to see. Like, for example, if it's my own personal clinic, you will see my certificate. You know, you will
without
see that,
without necessarily wanting.
You don't have to ask for it, because again, we have to also look for it. You know, like if you have to look for it, it's a lot, and then I have like 50 patients.
And of course, you won't treat me right. Imagine
it might change if because you're doubting what the doctor is saying. You know, then you might offend them in some way. But what also luckily and the good thing is that the health system and the board, we have the Kenya Medical Practitioners Board, which is also called the KMPDC, which puts regulations on such places. Of course, kuna wale wanapita, they miss the, you know, but they ideally right now, they're really doing even a crackdown on these clinics that don't have the right certification, and it happens because when you look at everyone, they have had some, you know, interaction with the KMPDC. So that is there. We are required to have our licenses. So before you even open any place, you must have your practice license as the person who owns the place. But the owner may not even be a doctor anyway. Maybe somebody. You know, that's a funny thing.
I may set up my own clinic and then it's a doctor.
You can still do that. But the clinic itself has to have the right certification and inspection. Inspection must have been done even by the city council. So there are several health checks for any place that's open. So not all of them are rogue. But again, don't go to any. Why go to those and start looking for licenses? If you feel this is not safe for you, go to a place that you feel is safe for you. You know, like a place that has been established. New places also are good, but we usually put our certifications, you will see.
Okay.
Yeah.
Thank you so much. I don't know why we went into all that system. It was just a very, I was curious.
Yeah.
But tell us about what you do. I really liked, of course, we met through the function you had for Dr. K Foundation, and I was so interested, and I was so happy for you.
Thank you.
I feel like you're doing a very good job. So that's what I want you to tell us, you
Yeah.
know, about what you do in Dr. K Foundation and how you got into it.
Wow, thank you so much, actually, because you showed up and you joined us, and it was really fun and interesting. It was we did have a work recently about menstrual hygiene, and we learned a lot. Even I learned about a menstrual disc.
Cup and a disc.
Yeah, I didn't know about the disc. So you see,
it was the first time I think we saw them.
Yes, and the numbers, the people who came, the girls who came, the men who came was amazing. So talking about Dr. K Foundation, which was now the organizer of the work, I started Dr. K. Actually, we started officially in January this year, and now this is July. But earlier on, we had some activities going on, and how it started was in 2020. There was COVID, there was lockdown, schools had closed, and then now suddenly we had an upsurge of pregnancies. Over 100,000 recorded teenage pregnancies in Kenya by the Ministry of Health. And that was alarming for me, because 100,000, what are we doing? Honestly. 100,000 teenage mothers is equal to 100,000 risky pregnancies, is equal to 100,000 class dropouts, 100,000 babies, or even more, because there could be multiples, who have come into a world where they have a young mother, they might not feed well, they might not survive up to 5 years. Then we have now an increase in infant mortality rate, or even an increase in under 5 mortality rate, which is a cascade of events. The question is, where did this 100,000, how did this 100,000 girls come to be? Or maybe we had this 100,000 before, and because we didn't document it as much, it's coming out during COVID. So, and even if we did have it before, what are we doing about it? That's an alarming number, and I think it was a number that affected, my thought. It got to me, and I said, but I've been doing a few YouTube videos as just Dr. K, and I didn't feel like it was making impact the way I would have liked to. And I also like feedback. So I decided one day I'm going to help these girls, and the only way I can do it at that moment, because there's no physical meeting, let me do it on social media. I put my phone, I was seated in my car at the parking after work, and I put my phone up, removed my mask, and called everyone who's under 21 years of age to join me on a WhatsApp group, and I will guide them when it comes to their mental and reproductive health. Wow. And in fact, I made the first one, then I needed to make the second follow-up. The videos went like 1,000, like many girls. They would just forward it to other people and say, there's a free WhatsApp group with a gynae.
Oh, wow.
Yes. And that's how I got the first 150 girls on a WhatsApp group, because they would reach out on. So I was personally doing it because I would have to check on my Instagram who has asked. They've sent me their number, I asked their name, and then put them. So I know everyone by name. The first group of girls that I had, and they were all under 21. The youngest was 16 years. And then, of course, I had a few asking under 16, but I didn't put the younger ones below 16 because the discussion would be different. But I wanted one group full at that time. So we started 16 years all the way. I had a 24-year-old and a 26-year-old. They just said, please put me in that group. I need it.
So they were asking questions.
They would we would discuss everything. They would ask questions on sex, health, mental, anything. Mental health, reproductive. Now, when we're having those discussions, we're talking even about contraceptive here, because we cannot just ignore the fact that there's contraceptive issues and beliefs and myths and even age You know, in our country, you
Yeah.
can't give out contraceptives and to an under 18.
That's the thing.
You
and,
see,
and
so
yet,
what happens to the
yeah,
16-year-old
yeah.
who's already having sex?
Yeah.
Do I ignore the fact that she's probably going to conceive again and again, maybe 2 other times before she gets to 18? And that's a problem, you know. So we would discuss it at length. Abortions were also things we would discuss. We would discuss now parental issues, because now at this point I realize we're not just dealing with reproductive health, we're dealing with their pasts, we're dealing with their parents, or the lack of it. We're dealing with their relationships, because they do have relationships.
They have.
They
And
have,
they keep coming.
yes,
They have questions.
they have boyfriends, they have
Yeah,
girlfriends.
yeah.
There are things that are going on, even within normal friendships, that make them decide what they decide when it comes to their mental and reproductive health. So the mental and reproductive, the result is from their pasts, from their economic issues, from their parental issues, so physical, even spiritual. So we realized that I said we because I couldn't do it alone. I added other gynecologists. I have psychologists, I have psychiatrists, beauticians, even a dermatologist, you know. So now the group, I thought about it and we said, oh my God, we can't deal with results when we can't deal with, we have to deal with the root cause. What is the root cause of all this? And that comes to the social things, economic things. So that's how now Dr. K Foundation came to be.
Wow.
But it's important that I mentioned that within the same group, 2 years later, because now this is 3 years, almost 3 years now, 2 years later, I had this young girl who called me and told me, because at the end of last year, November, I wanted to meet them because I never met them. I know them by name. We've discussed things, even in
talk
detail.
a lot, but we haven't met physically.
Serious things.
I
Even
can
some of them on
imagine.
side chat,
Yeah.
So I feel like I know them, but I don't see them. I have not seen them. I asked for a meeting in November. But before then, I had my exam, my research. Now being a resident, I had research and all that. So there's a period I kept quiet on the group. So one of them called me, Dr. K, how are you? Okay, there's someone would even call and find out, how are you doing? How's everything? I just wanted to know how you're doing. You know, that makes me so happy, you know. So one of them also called me, and then she told me, you know, you planned for a meeting in November, but we've not talked about it the last 1 month. Let me help you.
Oh.
And I said, oh my God, yes, I need some help here. And then from there, we started having a discussion. She recruited another one. So we're 3 of us. And they planned for the whole thing.
Wow.
The 2 of them.
Yeah.
And that's when we had the first picnic.
Wow.
Yes, we had the first picnic where we met a few girls.
Yeah.
And then we launched. That's the day, it's like we said, we are starting the foundation.
Yeah. That's
Yes. And that's how we started the foundation. Then to push forward to January, that's when now we started doing the registration and all that. But in the meantime, we started having a lot of activities, online activities, planned by my girls, the ones who learned. Now they're 21, turning 22 this year.
Wow.
Yes, they were, I think, 18 or so that time.
When we recruited them.
They learned through the group. So what they learned is what they're using right now.
Wow.
And then so we made it in a way that now we can be able to incorporate all the different groups. Now the under 21-year-olds were over 21, so we had to make a new call, which we did this year for another group of under 21-year-olds. A few of them still remained. Then from that group, the ones who grew up, we didn't throw them away. We asked them, would you like to be big sisters? Now that's the second. Big sisters help and teach the younger ones. So at least now that one, there's some progress, because now they're the ones who are teaching, not me, not Dr. K only. Now I have a group, a team that can be able to teach the others, and then can also do school outreaches and all this that we are able to do right now. And then the third group is now we incorporate everyone who's an adult, anyone who's above 21, including some of the big sisters. They remain in the big group. The big group is now mixed, because the discussions we have there is different from under 21-year-olds.
So question, wow, that is so good. You know, we all desire to do things. Trust me. From where we sit in our homes, you watch news and then you're like, oh my God, that is so sad. But there's only maybe that's how we think. We tend to think that there's only so much you can do. So you've made a difference, by stepping out and actually deciding to do that.
Yeah.
So question is, were they pregnant? How did you know? Were they mothers? Were they pregnant, or they were just girls?
So what I did, I didn't target any particular group. I just wanted anyone who's under 21 years that needs any form of help when it comes to knowledge of their reproductive health. And I'm able to also direct them to the rightful areas where they can get help. So in that group, I didn't have anyone who was pregnant. I had an occasion of one or two who got pregnant along the way. So it's good to mention, because out of the rest are not until now they are still, they are knowledgeable. They've not, gotten into early pregnancy. But one of them, out of the under 21, they wanted to be pregnant at 21. So that was because of her choice, and she's an adult, but one, it was not planned. And during this time, when we discussed with her, eventually she decided to keep the baby, because before anyone decides to do anything, we have to have like lengthy discussions over things. I usually tell my people, if you come to me to come and terminate a pregnancy, I understand where you're coming from. Unfortunately, our country does not give laws that it's still illegal to terminate a healthy pregnancy in a healthy mother. There are some only particular situations where you can do that. But I always tell them, when you come to me, I'll talk to you in a way that we are going to manage this pregnancy. Whatever you choose is okay. You're the one choosing. But when we are doing this, we choose together. But when you're coming to me, if we're going on with this journey, we are going on with this journey. Okay? So that those are the difficult sometimes situations you can get where a girl has decided that, no, I'm not keeping this pregnancy for this particular, and they have
the reasons are there.
They do, and we don't judge, because whatever, it's your body, right? It's your body, So there are ways we manage those patients, but luckily within the same group, we didn't have instances of many, pregnancy and unwanted pregnancies. I had cases of, someone who probably contracted a sexually transmitted infection, and we've managed it. Most of them are usually treatable, but again, after that, we still instill information. We have to remind, because I can teach you now, right now, but tomorrow you decide to do what you decide to do. And
question is, because I'm thinking, why even stopping at 21? I feel like even us, we need the knowledge, we need to be taught, we need the information, because I feel like we circle it back to like comprehensive sexual education, which most of us are lacking. And you are saying you are dealing with such things, the past, the root cause, parents and what have you. So it's like going back to, what did we ever know, you know, about sex and the whole component. And coming up, our spiritual beliefs entered, the religious beliefs entered. So we are young mothers, newly married, and we have zero idea of what we are about to encounter. Some. Because I feel like most young Africans, most African women, that's where we are finding ourselves. And then now, even when you're there, what we lack is a society, someone I can tell, hey, what was that that happened to me, or what is this that I'm going through, And there's the issue of, okay, I need a gyna. Or I feel like, okay, certain people can afford gynas, and I'm waiting to earn this much to afford a gyna. And all this. So I'm staying with a lot of questions, or I had this, I had this, so I'm not sure whether I'm going through an infection or whether I'm going through effects of too much sex. Someone recently told me, there's a lady who told me their father told them that when they have too much sex, they'll be what is it, they won't be able to get kids. And we were arguing about this thing of teaching young people and giving them all the knowledge, all the rights, and then letting them choose. So I think that was our argument. And she's an older woman, and she actually told me that.
Imagine you're right. we have it's not even just the people in their reproductive age. We have also postmenopausal women or even gentlemen who want to understand some of these things because they didn't realize
we don't have
the things that you don't we still didn't get taught when we were younger, you know, like because your parents probably were still worried or scared or you know, skeptic about talking about sex and won't talk about it, understandably, because they went through the same, you know, situations. So in the foundation we have the over 21. It means anyone who's above 21 can join. There we have webinars where we discuss different things.
Oh, nice.
Yeah, so we have webinars, we have trainings for, now you see, webinars are for teaching, like I can talk about fibroids, I can talk about sexual health, I can talk about something, anything that will help, even post-menopause, because we forget women who are going through menopause. Yet we believe, you know, because you don't think that you're gonna reach there, but you're gonna reach there, you know, about sex, you know, sex addiction. Those are the kind of things that we need to do, because there's a lot of things happening. There's a lot of access to internet, there's a lot of access to different, you know, people are deviant, right? A lot of information, you know, and misinformation also going out there. Like right now, recently I was treating a patient who was even taking something, putting things in the, you know, in the vagina,
body parts.
Because they believe that they will help in doing some kind of treatment for,
and all these things we are seeing on the internet, by the way.
Hey,
and we are buying them.
People are buying,
and
then they come back with more infections. You know, I don't know how people can get, you know, because decisions are made by, but we don't have regulations against, or regulations for herbal things. We have regulations for conventional medicine. But we always say don't do any, don't put things, don't treat what is not broken, you know.
As we want to be
virgins. You want to smell nice.
We want to be virgins again.
You know, virgins how are you going to be virgin
Please
again?
leave us. How? We're trying to repair our vaginas back
and why for somebody else?
Imagine.
Not even for
by
yourself.
The way, it's not even
what does
for
virginity
yourself.
have to do with me personally? Like me, I'm still living, I'm working, I'm free. But what does that have to do with my own? It's because of somebody else. And did that somebody else ask you to become a virgin again? So it doesn't make sense. Sometimes we put so much pressure on ourselves. But yet I agree that we still need to make ways where we can open up information for people who we think that they know, but they don't. My assistant now, Night, and also the Enjoy, the two of them who said the whole thing. They would even tell me, I don't know about tampon. I've never used a tampon. So I had to show them, this is a tampon. Like, hey, this is how it looks. Ah, I'm surprised. You live in Nairobi. You live in
Let me tell you.
They don't.
Let me tell you. I've lived in Nairobi all my life. But before I could afford that box of tampon, trust me. And before I could actually, even if I have the money, there's a certain mentality that, you know, it's just for certain kind of people. I don't know why that is.
I think it's
and then we just grow up, and then by the time you're like, I can actually pick it from the shelf, pay for it, and go and use it. And nothing will happen to me. First, okay, you do that, you go over that stage, and then now, okay, so I need to learn how to use it. So I read the instructions vizuri, but the day I will go through that, it's called the shock, what, I won't even know that's I won't even know that that's what I'm going through. Secondly, or third, I have no one to discuss it with. Now I'm this whole big person. Who am I going to tell that I had TSS or I'm feeling like this? But then there's just a day, it was so funny. And I was like, I'm feeling funny. I'm feeling funny. Then by the time I'm going to change the tampon, I'm like, oh, that was it. By the time it hits me that was, you know. So having that society support structure or system, or just having, you know, a group of people that you can discuss it with or ask questions or do what you're doing, a very good job. Trust me.
Thank you. We're trying to do our, you know, and also increase our capacity, because, you know, the more you grow, you realize there's more things that you need to deal with every single day. Not just, you know, it's not, when you started something like this, no one told me that, you know, like, you know, if I knew about it, maybe earlier, maybe I'd have just said, I can't, you know.
You couldn't have started the WhatsApp.
Maybe it's a good, maybe it's a good thing that you just don't know what you get into at the beginning.
Yeah.
But the rewards you get, like once you get a message saying you really helped me when it was this time, you know, I went to school at this time when I couldn't, when my parents had refused, you know, because I was supposed to be married off, because I have someone from Garissa, someone from, you know, like, you know, a lot of, they're going through a lot of things, you know. When you're doing some things like this, they give you motivation. So every single day we wake up, we still have to have conversations on the groups, because it's not just one group at this point. I have the Big Sisters, I have the Under 21, and I have the Dr. K Foundation, now the bigger one. So those are 3 arms, and those 3 arms need attention differently.
I can imagine.
And then there are individuals who will send message here, say, oh, I'm going through depression. And they're saying because they're looking for help. You can't ignore. You just can't. But at the same time, thankfully, I have psychology. So there are things that you have to set up so that you can be able to be able to run some of these things. Yeah, but we hope to do that. I've been asked about boys, because we've talked about the over 21 who are mixed.
Okay.
Because now we can't separate what goes through men and women, and their reproductive is all because there's interaction between men and women. But now under 21, been asked, what about the boys? You know, so I need a task force that involves men who understand the problems that the boys are going through, so that I can be able to now create that group. Because me as Dr. K, I may not understand all the details as to what boy child is going through. Boy child is still going through alcohol, is pressure in school. I've seen a lot of sodomy happening, including my close friends who opened up recently. Some of them would tell me that, you know, by the way, what this person is talking about happened to me, but I just couldn't tell anybody. Imagine. So it's hurtful to know, you know, our boys are also not safe. They still need information. They need to know this is wrong. They don't know. Some of them don't know because they've gone through it, you know. And it's very hurtful to see a boy, you know, I don't know, there's something about also a boy being disheveled, you know. It's it hurts me to see boys in high school, you know, not having that. They need to have the encouragement, because they're the ones who take charge.
The masculinity.
Exactly. So it's stripped away from them. And it's being stripped away very young. From your, maybe even at home, someone is stripping it away, you know, telling you you're nothing, you're not even a boy enough, you know. What is a boy enough? We don't know what a man enough is. We don't know those kind of statements. We want you to grow into who you're supposed to be, you know. And those are the kind of things now we're also thinking to get into.
I'm so happy for you.
Thank you.
Guys, can people look for you?
Yeah.
On Dr. K Foundation on Instagram, if women want to join you or want to join the groups or want to contribute in any way, you know. Right.
We are an open foundation, so we allow people to join us. And how they join us is to either follow us, join the WhatsApp groups, because they will get some help and also get information that will help them, and also take part in our activities. For example, the walk we did have for menstrual hygiene, and we're stopping the shaming because of the previous things that have been happening in the world, not just in the country. You can participate in any way in terms of being part of the foundation, or even being a sponsor or a donor to the foundation, because we need a lot of these things that we do. We usually need a lot of resources to help us. Like now we took things to the Raja Academy, the one that was receiving pads, and that was done already I think 2-3 weeks ago, where we were able to join them during their graduation, give them the pads. They were very, very happy. It's a beautiful, beautiful school, by the way, that people should know about, that helps girls from marginalized places. And they get in for free, they learn for free, they get pads, they get, you know, the donor also, there's one donor, but I think they need more, definitely. They get pads for free, you know. Giving a couple of girls pads every month is not easy. So when we're doing that, also that costs, you know, it's not just free. As much as you're doing that, it costs you to go there, you know. It's a lot of resources that are needed. And of course, even going for the school outreaches that we do, because we are targeting to get from the 2 upper classes in high school, 2 upper classes in primary, so that we can be able to teach. It's an actual curriculum where we teach them about reproductive health. So for the younger ones, they learn more of pads you know, what to wear, how to wear, and most of the time it's pads, you know. Giving them the options of pads is usually reusable pads. As we continued, we also realized that as much as we also give these reusable pads, sometimes we can give them out, but do these people have water to wash them? So maybe now we go back to the disposable, because disposable you don't need to wash, but how cheap or expensive are they? So those are the challenges we're having. We need water. We need water in these places where we are teaching. So some of these things we are learning, and we're trying to see how we can be able to help these girls in different places. So for the older girls, it's more of decision making as well. And what we realized is that we need to negotiate. Negotiating power is a skill. So if I come and you tell me that I'm 16, and you tell me you love me, you're a guy, you're 19, and you love me, oh my God, you're the most beautiful girl in the world, and what I need to have sex with. I want to, I desire. You know, the initial feeling for the girl is excitement. You feel so beautiful. You feel gorgeous. You know, like you're wanted, you're needed. But then again, we also need to negotiate with, first of all, ourselves, our minds. It's a skill. So that's one of the skills that we teach. We want to entail in our high schoolers, because most of the things that happen is in university. Just to say the truth. True. Is the truth. Everyone will learn alcohol, will learn sex, will learn after 8, most of them, although we have...
There's like a pressure. I don't know who we're
it's
talking
like
to about.
Normal.
There's like a pressure. They're like, now you're 18. Now you have this ID. Then you're what? Actually, you're still a virgin. For what? For
what's
who?
the point? You know? And what is this
It's
thing?
a very bad...
but most of the things you're introduced just
around
after that age group.
Exactly. I don't
Just
know what
from,
the pressure...
From 3 and above. That's the time things happen. Because at this point now you're ready to explore, your hormones are all over the place, and you're now finishing school. So umesikia umemaliza. You know, negotiating with yourself, number 1 is the first one. Like, okay, but what are the benefits to... You know, when do you start to think benefits?
But are you self-aware?
That's the thing.
At that age, really, to sit down. You know, you and I can sit down and say, okay, I'll sit and you know, have that conversation with myself and say, like, you know, let's stop. You know. But when you're in Form 4 or when you've just finished, you see, you're still
so new to everything.
And you're still struggling with your parents. Are you still a kid, or are you... Alafu unaambiwa zile statements mbaya za African home. Sasa uko na nini, unaona unaweza ni treat.
You know, but that's why we do the training, so that they can be self-aware. I know there's that point where when you're younger, you'll be surprised that there's so much you pick up, even when you're in school, because where I was in school, they said that mnafinyiliwa sana, that mkitoka Form 4 mnachilia. Like you just become the craziest and all that.
Ulikuwa umefungiwa sana.
Umefungiwa, okay? But that is when I was, like, I remember when I was in Form 3, Form 4, I used to pick up a lot of information that in later life I would look back and say, by the way, this kind of helped me at this point. Some of them, they would teach us, like we would have people who, alumni would come and give us and tell us, by the way, when you go out there, it's going to be like, they tell you the truth. I wish it was more often, to be honest, because that would remind me that this is probably going to happen. When I see it, at least I have the choice. You know, then the choice you make, then you say, I'll take up. So those are the kind of thing we teach them. We say that you need to know, so that when you make the decision to do it, remember that you will take up the responsibility of whatever decision you'll make. You know, so the point is to help them get that self-awareness faster than when you get to 30s, because that's what most people, when you get to 30, you're like, now I understand myself. You're like, wow. You know? But we want
like, what was that?
To grow, we want to grow girls who will realize themselves earlier than when they get to their 30s. So that their 30s,
interestingly, they are.
Interestingly,
they are. Our younger girls are very, you know, they are woke. They know what they're doing.
They know. And the beauty is that they know that they can freely talk to like now, in the foundation, we open it in a way that they're freely talking to at least one of our doctors or one of our professionals about things in life. They're counselors and all, because to be honest, even us ourselves, we also need it. Not we just didn't have.
We need it.
When we were in our 20s, we didn't even know where to go. Did you know that I'm not even advertising Kenya because I work there and I know that there's a youth clinic that is available for anyone who's under 24 years and they're Kenyan. For all these things, for free.
What?
Yeah. I need to make another video. Reproductive health, mental health, any issue that you have and you're a youth, you're covered in that clinic. 24
and below, for free.
For free.
You can go and talk to someone.
Yeah.
We don't know.
There's talking to someone, counselor, there's and then we have a duty now. Us as ObsGynae, we have a particular every week. There's someone, who's assigned for that number 20. Sorry, it's called a youth clinic. Yeah. Someone who goes there to go and see whoever has an issue, and it's free.
Wow.
Yeah. They call us. In fact, they don't call us enough. So I think we're not doing enough. They don't call us enough. Of course, when I went to talk to them also before I made the video, they told me that also they wish they can have more capacity. They do it, yes, but you also have to have like some form of because they have to open records and all those things. Sometimes they're overwhelmed by the number of people they get. That sometimes they also need more funding. So, but how do you get funding? If you can push more people, that's when you can say we have too many people. Give us funding. So may I urge, if you're under 24 years, please just go
and
to
you don't know where to go,
and you don't know
who
where to
to
go.
talk
It's
to.
free.
True, by the way. And that's the age where girls and mothers are fighting. They're usually fighting. I don't know why.
But it's true because now you're discovering yourself. You're almost a similar character as your mom. And now you
guys are just
so you're just while there are others who really go together very well.
Thank you so much, Dr. K. Anything else that you may want to tell us?
Oh my God. So I mean, I want people to join us to do more. Also support us. Supporting means in any way. Sometimes it can be something we are preparing for. An event or something, and you're an event organizer. You can help us do the event organizing. As we are continuing to grow, this is to help other people, and especially our young girls in the country. Then also there's a book that's coming up. Yes, so I will be having a bit of more interaction maybe with you also, and let you know when we are getting them out, because these are books that will this particular one will be helping pregnant women, and also for another one for teenagers.
Wow. Thank you so much for coming, Dr. K. I've really enjoyed this session. I have also learned I need to join Dr. K Foundation also and just ask all my questions over there. Thank you.
Thank you so
Guys,
much.
you can go back and interact with our content. For those who haven't watched the previous episodes, they are on our YouTube at Be Different KE Podcast on all social media platforms. Join us and let's continue having this conversation. Thank you so much for joining us and have a good one.